Oh, you got it, Rose? All right, Rose, are you ready? Okay. Now, go ahead and get the ventilator running, and I'll give you the settings. He is on he's on assist control mode, rated 12, auto volume is 750. FiO2 is 45, heat of 5. Now, do not put him on the ventilator, because he won't ventilate. We all ventilate.
FiO2 45? FiO2 45?
FiO2 45. That's fine.
What was the flow?
He might ventilate at those layers. Okay, listen, guys. Hey. Guys, come on. Listen. Okay, AC at 12. 750. Oh, we can't ventilate him at 750. I know he won't do that. No, 45. So keep it 5. Leave him on the test line. Just lay the test line up there. Keep it 5.
Hello, it's 45, right? Keep it 5.
Okay, Bill, you can stop banging him. Okay. So I'm going to put him on. I'm going to just have him breathe at a rate of 12 again. Yeah, he doesn't ventilate well. I mean, on the ventilator. Go ahead and take him off. Yeah. Okay, so we got him on the ventilator.
You trying to tell me? I might.
Excuse me.
Where's the safe?
Oh, I don't know. Put him on the down there. So we'll
Thank you.
all right, here we go. ADD's, listen, ADD's following placement on mechanical ventilation. pH is 7.32, PCO2 of 38, bicarb of 19, PaO2 of 91. The EKG is, let me do this, and you tell me what it is.
Bicarb was 18? 19. CO2 38, O2 91.
Okay, so that, yeah. Okay, so there's his heart rate. What is it? And what is it? Tell me what the ECG rhythm is up there in his heart rate. Which is what? He's tachycardic. So, and what does the rhythm look like? You only have a few choices. I mean, does it look regular? No. It does look kind of funny up there, doesn't it? Yeah. It's actually supposed to be just sinus tachycardia. I don't know why my... Oh, I know why it's doing that. Hold on. I think I know why. Now look at it and tell me. There you go. Now look at it. There you go.
Yeah.
I forgot to take the PVCs away. The PVCs went away because of the line pin, right?
Okay.
Okay, so, all right, so I gave you his blood gases, right?
Yep.
7.32, 38 CO2, 19 bicarb, 21 PO, or 91 PO2, and let me change his saturation because it's probably up here somewhere. They don't give saturation in these scenarios, so I'm making saturation. All right, so here he is on the monitor up there. He's on the ventilator. He's ventilating. He's doing okay. And it says, what recommendations would you now make in the patient's care? Now, it's going to give you a bunch of choices. I don't have all those down, but, you know, it's going to say, do you want to change the volume? Do you want to change the respiratory rate? Do you want to maintain present therapy and continue to monitor? And they don't give you a choice of giving bicarb. So it's increased respiratory rate, increased FiO2, and to 65, and or maintain present therapy and continue to monitor. Yeah, maintain and continue to monitor because there's really nothing severely wrong with him. He is in a little bit of acidosis, right? I mean, he's 7.32, it's metabolic. Are you going to change that real quick? No. You could give him bicarb, and I agree. We probably could give him bicarb. They don't put that in the scenario, though, I'm sorry. But that would be a choice. The only other choice they give is to maintain present therapy. So they're going to give you some choices to change some ventilator settings to do something. But there's nothing wrong with the ventilator settings the way they are. None of them are going to change anything. His PO2 is 91. That's okay, isn't it? You know, on the 45%, there's no reason to go up on that. Because remember, we try to maintain maintain low PO2s, right? Or well, low PO2s, but low FiO2s also. So there's really no reason to change all that. Okay. Now, if his PO2 were 81, then I might, but it's not. So remember, look at the blood gases, and don't always change it because, well, you know, we're metabolic acidosis. But you know, if they don't give you a bicarb, then there's nothing else to change. You're going to maintain.
81 wouldn't be okay still because it's sort of within that normal.
Well, it says 80 to 100. Yeah, 81 might be all right, but I might increase a little bit at 81. I don't know. But it probably, yeah, 81 probably be all right. Yeah, I guess it should have said 71. This is 71 as well.
Yeah.
Okay.
Okay.
All right. So it says 3 days later. Okay, 3 days later. So you can maintain. The patient remains intubated and on mechanical ventilatory support. The physician asks you to assess the patient's cardiopulmonary status. What of the following would you now assess? And again, this goes back to your normal, now think your ventilator, okay? So they're asking you for your normal ventilator settings, high volume respiratory rate, blood gases, x-rays, and all that. So what do you want to get on him now? In 3 days, okay? Since you've looked at the thing. So what do you want to look at?
Blood gas.
Okay, so we'll get a blood gas, 7.36, PCO2 is 42, bicarb is 23, and PO2 is 98. Okay?
Say it again.
7.36, 42,
That's fine.
23, and 98 PO2.
Yeah.
Okay.
Blood gases
What
are
else? Think of it like, what do you want to know?
compliant.
What's his?
You want to know his vent settings. Okay, so now he's on pressure support ventilation of 6. He changes if you want.
Pressure support.
He's on pressure support ventilation 6 with an FiO2 of 35% and a CPAP of 5. Yeah. Yeah, that's what he's on. I mean, they just the way they wrote it in this but that's what he's on. He's on CPAP of 5 with pressure support of 6 and an FiO2 of 35%.
So we're getting ready to.
So what else? Yeah, but what do you need? What else would you want to know about?
How long has he been on?
Okay, then, well, we're 3 days now, so I don't know if he's been on this for a day or 2 days. It doesn't say that, but, you know, 3 days later, you're checking him. You've been off, and then you come back.
Rapid, shallow.
Side volume, his spontaneous volume is 375.
He's ready.
His spontaneous rate is 16. They don't give an RSBI. They you know, haven't gotten into that yet. What else you want to look at?
Negative inspiratory force.
Okay, they don't give it, but, okay. What did it say, it's normal? What, X-ray, okay? So his chest X-ray, proper ET tube placement, good bilateral aeration, okay?
He's ready.
Okay, so are you okay there?
Yeah.
Okay.
Yeah.
Could be some other things yet still that you missed, but, okay. All right, you report your findings to the physician, and he asks for your recommendation. What do you want to do?
Extubate.
Okay, and what?
What is it?
Non-rebreathing.
No, mini mask.
Okay, possibly a mini mask, okay? No, we're just going to extubate. Yeah, we're extubating, but what's your choice of oxygen? Now, I don't have it all down. Yeah, they could say extubate, place on Venturi mask at 45%. They could say place on nasal cannula 3 liters, or they could play cool aerosol mist at 35%, something like that. So what do you want to put him on?
Mini mask.
Mini mask.
Mini mask for
Don't always think about what you're doing in the hospital, okay? And what they want on here is a cool mist at 35%. Why do they want the cool mist?
Okay.
And to soothe the throat. So that's why they're saying the cool mist.
Okay.
So let's extubate him. And we will, I didn't bring in a cool aerosol, so we'll fake it. I didn't bring in a cool aerosol. So let it extubate him. Make sure you take the air out of it first.
Right. Because
Yeah.
he's had this.
We're going to extubate him and we're going to put him on a cool aerosol 35%.
Yeah. How does that feel, Joel? That feel good?
Suction.
Yeah, suction, extubate, turn the ventilator off. Get all the air out.
Cough.
Good.
Semi-Fowler.
All right, so,
Shouldn't it be a little up, Sammy?
all right.
Powder? Yeah.
All right, so now we're gonna put him on a, yeah, you can set him up. You can set him up. And we would put him on a cool mist. I didn't bring one in. I forgot about that. I'm sorry, but we put him on a cool mist aerosol.
Is
Okay.
it a simple mask with its cool mist, or what does it look like?
No, the aerosol mask. Aerosol mask with the corrugated tubing and a nebulizer. Okay, and you set the nebulizer at 35%. Okay, I'm sorry, I should have had that in here.
And why would you do that instead of doing a Benny mask?
It's just on him because he's been intubated for several days, and it's for the swelling and just for the soothing effect from the tube that they'll put a cool mist on him. Do we do that much out there today? Absolutely not. You know, at best
That's why
we
we
want
do a
to.
leak test, right?
Huh?
And that's why we done the leak test?
Yeah, that's why you do a leak test now. See,
Right.
like I say, some of these sims, they are older in what they're looking at, because you won't find RSBIs on these most of the time and that kind of stuff, especially on some of these older ones. I mean, this one's only a couple years old, but even still, they can do all of that. So they went with a cool mist, where I'd probably just put him on a Benny mask. You're right, you know, okay? All right, it says the next morning, okay, the patient's having increased respiratory distress with respiratory rates of 28 to 32. Chest X-ray reveals bilateral infiltrates. This is not really his X-ray. There will be an X-ray on the stem. It says bilateral infiltrates on both bases and haziness with hilar area and blunting of both claustrophrenic angles. ABGs are 7.47. PCO2 is 32. His bicarb's 22, and his PaO2 is 66. What would you recommend at this time? Yeah, huh? Okay. So, I didn't write down all, but they will go through. Do you want to, you know, would you maybe put him on BiPAP? Would you re-intubate him? Would you just increase his oxygen to something? Would you obtain CT pulmonary angiogram? You know, would you take him to MRI?
I put him on bypass. You said
Yeah.
28.
Bypass to slow the fluid.
Okay,
Let us know now. Would you get late?
Pressure.
And
See it all?
no, probably not. It's possible. They don't give you blood pressure and all that to make that determination, so I wouldn't do anything with that right now. But he's gone into respiratory distress, so how are we going to find out real quick what's happening? Would be by X-ray of some type. So what they want is CT pulmonary angiogram on him, is what they want, because you're looking for a possible what? Think about this. What are you looking for? He's got increased respiratory rate. The infiltrates on both sides. He's in distress. He's having difficulty breathing.
Ardid?
ARDS what?
Ard?
Well, but you wouldn't think he would be in ARDS now. He could, but if he had done well, we extubated him. Pulmonary emboli. Yeah, we'd be thinking of probably a pulmonary emboli. That's why you do pulmonary angiogram. Right? So you think of a pulmonary emboli. Okay.
Ooh.
Pulmonary, yeah, CT pulmonary angiogram. And it says results reveal bilateral pulmonary emboli, and it says thrombolytic therapy is initiated. So then he gets, you know, then you start him on heparin therapy or something, you know. Cool.
So can you shoot at us some of those ones that scenarios where you need a lidocaine scenario where you said magnesium was the it's already gone, Torsade, and then Epi. Like,
Well,
what do you need
actually, I will have to look back and see exactly how much is on there. But I sent you, I put two files up all ago. One of them was